Good evening, everybody. I'm Michael Barasch, and welcome to our webinar. We are here to tell you what your rights are under the two bills passed by Congress. And I'm so thrilled that we're doing this. So with me tonight, my partner, Lee London, and we also have with us Louise, Schoene, and I'll have everybody introduce themselves in a second. Brian Brown-Cashdollar, Liam Lynch, and John Feal. I think this is going to be really interesting and, as I said, informative. So let's start with a short little video to just set the table, and then I'll have everybody introduce themselves, and then we'll get going.
The first thing that I hear from the non-first responder community in Lower Manhattan is, look, I'm sick, but I don't deserve anything. I'm not a first responder. I just lived here. I just studied here. I just went to school here. I just raised a family here. Your presence here was an act of courage and resilience. The first responders, I'm in awe. But I also am in great awe of those who came back to a war-torn neighborhood that was clearly toxic. We knew it, but you stayed anyway, and you allowed this area to grow and to become the hub. But it's your courage and your resilience that brought this place back. So please, I urge you, access what you are owed.
Over the last decade, we have all fought very hard so that everyone has access to the health care that they need. It is very important that every community member who lived anywhere south of Houston understands that you are covered. You are part of the group of people that have guaranteed health care if you have a 9/11 related disease.
I was on my way to work when the first plane hit. I was working for Goldman Sachs. I actually worked for them for a total of 21 years. I always thought that those programs were geared for the firemen and the police officers, but I'm one of the victims of that.
So we have taken on, with all of these advocates here, the task of trying to get everyone to understand that they have rights, and it is imperative that they sign up.
It's also critical that we reach our students and our staff members, our teachers who were in the schools 18 years ago.
One of the really surprising things about our research is that an event in 2001 can continue to have echoes 17 and 18 years later, such that it is as though never smokers are smoking 2 packs a day.
Our law firm now represents over 25,000 people in the 9/11 community.
The majority right now are first responders, but every single day we hear from more and more survivors because we're doing this outreach. Basically, to be entitled to compensation, you need to prove that you were below Canal Street or on the Fresh Kills landfill, either caught in the dust cloud on 9/11 or for 24 hours during the month of September 2001, or for 80 hours, which is just 2 full work weeks between 9/11 and May 30th of 2002. And you need to get 2 people to sign an affidavit attesting to the fact that I saw him. I worked next to Joe. I went to school next to Francis. That's all it takes. There's a reason why my firm takes all this so personally. I have 6 young people who work for me who have lost a parent or a spouse as a result of World Trade Center toxins. 9 people in my law firm, including me, are cancer survivors. The information you get from us is going to be compassionate, and it's our pleasure to help you.
We're going to start now. I'd like to introduce John Feal of the FealGood Foundation. I was honored to walk the halls of Congress with John. John, tell us a little bit about your 9/11 and the experiences that you had before you got hurt down there. And then tell us a little bit about the FealGood Foundation and your lobbying efforts.
Well, one, thank you for having me, Michael. Thank you, Louise, for setting this up, and Brian. Anybody that's watching and listening to this, it's imperative, like your life depends on it, like you're going to die tomorrow, that you get into these programs. You're not only protecting yourself and your friends and your colleagues, you're protecting your family, God forbid something happens. Doesn't matter if you smoke 4 packs of cigarettes a day, this bill is presumptive. My personal story pales in comparison to those who are deathly ill, and to those who have died from their 9/11 related illnesses. It's a title that I am not proud of, but I am the worst injury at Ground Zero during the 10-month cleanup, when roughly 8,000 pounds of steel crushed my left foot, and I spent 11 weeks in the hospital with gangrene. But I've walked the halls of Congress for 17 years. Nobody has more miles in Washington, D.C. than me. But we ensured that we got this bill passed 3 times, so all of you here today can take advantage of our hard work. It's been an honor to work with Michael and Liam from NYCOSH and Lee, but we have a lot more work to do. 86% of the 9/11 responder communities are in the program. Only 10% of the survivor communities in the program. We need to reach out and make sure you're all entitled to what you deserve. This bill, this life-saving piece of legislation, is for everybody who is in that zone, who has an illness certified by the federal government. We're here to help you. We will hold your hand. We will walk you through the process, and we will ensure that you get what you deserve. Thank you.
Yeah, thank you, John. And that's actually where I met John, was back in 2010. We were down there lobbying as well. But the theme of today's webinar, as you heard John Stewart and everybody else saying, and John Feal just said it, is these programs that were set up by Congress, they're not just for New York City firefighters and cops. They're for the volunteers who came from upstate and Western New York. They're for the National Guards people who were assigned to come down here. We were all exposed to the same toxins. Not surprisingly, we're all coming down with the same illnesses, and more people have now died of 9/11 illnesses than the 2,977 people who died on 9/11, either here in New York or at the Pentagon. There's 2 different areas. If you were assigned or volunteered below Houston Street or in Western Brooklyn, you're eligible for the free nationwide World Trade Center health program. But if you were also below Canal Street or at the Pentagon or at the Fresh Kills landfill, you're also entitled to the Victim Compensation Fund, which we will talk about in a minute. But that has to have been below Canal Street, or at the Fresh Kills landfill, or at the Pentagon. So I want to introduce now Louise. Louise, would you introduce yourself, please, and tell us what you do and why you're so passionate about this?
On 9/11, when I was dropping off my husband at the Connecticut Street Armory in Buffalo, his commander told me that highest ranking officer's spouse was now the family coordinator, gave me the roster for the unit, and told me I was in charge of the families. A few years ago, like 3 years ago, Brian was trying to, from WNYCOSH, Western New York Council on Occupational Safety and Health, they were trying to gather help to support the Victims' Compensation Fund. And I volunteered to call up the unit because I saved the roster from all those years ago. So I started calling the people, and then I said to Brian, I would let my husband come. I said, but he has this growth in his throat and he's going to have surgery. He goes, that's 9/11. It's not 9/11. My husband was only at Ground Zero for like 2 weeks. And he says, no, Louise. He says the first 3 days, all they had to be there was a few hours. And once I believed, then it's like I connected with Ann Pearson from his unit and said, we've got to contact every single person in the unit and make sure they're getting screened, and then making sure that they get health care. And if they're entitled to something, we want to make sure that they get that. But then from the unit, it's like somebody has a cousin in this unit, somebody has a brother in another one, somebody's spouse is in another one. And the next thing you know, we're helping the state. And then it just grew from there. And we have basically helped anyone. I've helped news reporters from the Chicago Tribune, Verizon workers. It's like, we don't care. But the main thing that I want you to know, I just want to show you that all of your units is I don't know if you can see them, But what I do is we keep you together with your unit. And what keeps me up at night is it's not a unit like this, where it's just filled with people. That doesn't keep me up. It's what keeps me up at night is like this unit, where I have like maybe 6 people. I've seen people, soldiers, who have passed away before we even had the paperwork in. I just ask you all to like make sure everyone in your unit knows, for you to encourage them. And where somebody might say, you know, everybody gets cancer and this is not a, you know, this is just one unit. Over 50% of the people that I have helped all have kidney cancer. There is no question in my mind that from your service, you were at severe risk and that you need to protect your rights for yourself, for your family, your children, for all the people who care about you. So you can call me at any time. I will help anyone, whether I have COVID, heart surgery, you name it, and I have. But do this for yourself. Do this for yourself and don't wait. Don't wait until there's no one to sign an affidavit. Don't wait, because we are losing people every day.
Louise, thank you. Brian, would you please tell us a little bit about your organization, please?
Yes, hi. My name is Brian Brown-Cashdollar. I'm the director of the Western New York Council of Occupational Safety and Health, or WNYCOSH. We were founded in 1979. We actually started by working with workers in a Goodyear plant who were exposed to toluene. At the time, it was not identified as a cancer-causing agent, and out of that, we began working with the residents of the Love Canal. Throughout our 40-plus year history, we have been working with workers and families to eliminate workplace and environmental exposures. In 2019, we had joined the national push for the permanent passage of the World Trade Center Health Program. We were looking for 9/11 responders and their families to tell their stories at a Worker Memorial Day event that we were planning in 2019. After we met with Louise and Ann, we learned that there were actually thousands of Upstate responders who were never enrolled in the program, and many who had become sick and died, and they never connected their illness or the death of their loved ones to their service. After that, we began to work with Louise and Ann to get the word out to 9/11 responders and their families, and that work continues today. And I would actually even go a little bit farther. We have actually identified mechanics who worked with the sheriff's department here, who never went to ground zero, but was responsible for cleaning the vehicles when they came back, who ended up with the same cancers and ended up enrolling in the program. If you've had any risk of exposure, if your family had any risk of exposure to what took place on 9/11, or in this case, a vehicle that was down there, don't hesitate to register for the program. A lot of these illnesses are not going to be picked up by your primary care doctor.
Brian, I'm so glad you just said that, because we see that all the time. People go to private doctors and the doctor says, well, I don't know, your mother, you were a smoker, sir, or your mother had breast cancer. Well, let me just give a little background here, and then I'm going to ask Lee to talk about the cancers that are presumed linked. We represented Detective James Zadroga. Jimmy was 34 years old and he died of pulmonary fibrosis in 2006. They did an autopsy, and in his lung tissue, they found ground glass, asbestos, chromium, lead, benzene. That was some of the evidence that doctors used and needed, frankly, to link all these illnesses. And again, it's a presumption that if you were there, or as Brian was saying, if you cleaned the rigs that came back to Buffalo or Syracuse, wherever, your exposure to these toxins is presumed the cause of your respiratory illnesses and what is now 68 cancers. Lee, would you please take us through a slide that just shows the most common of the illnesses that have been linked by NYARNG?
thank you guys all for coming today. Even joining this webinar is tough just because I'm sure many of you get information about 9/11 exposure, don't know where to start, but we really want people to start this process when they're healthy. You guys are all first responders. This is not just for National Guard. This is for anyone who volunteered, responded from upstate New York. We want to make sure that you get the same updated information. John Feal lobbied Congress to get this fund permanently funded and extended for this reason, for everybody who never took advantage of the program when it first opened, and for everyone who, God forbid, will be diagnosed with something because it takes this long for conditions to develop. But anybody I speak to who's a first responder, you can join the World Trade Center Health Program if you're sick or not. Someone who worked in the zone at Merrill Lynch can only join the program if they're sick. But if you were a first responder or a volunteer, you can join the program even if you're perfectly healthy. And we're trying to encourage everyone to do that because, as Louise said, this process can be overwhelming, especially if, your friend, your coworker, anybody who you went down with, you lost contact with, could have passed away. We want to make sure you secure the proof of presence today. So God forbid, 5 years from now, you get diagnosed with prostate cancer. You're not scrambling to find witnesses. You're not scrambling to find anything. We want to set people up so they protect their future, they protect their family. But anytime I speak to anybody who has 9/11 exposure, caught in the dust cloud, was there, the second day, the third day, even if you were there, the exposure period is 9/11/2001 to May 30th of 2002. And the retirees are the ones being most impacted because they don't know that this program's available. Their family doesn't know, and they're not active, or they don't go on to retiree Facebook groups to even get this information. So that's why we host these informational seminars, and that's why we hope you'll take advantage. But just like Louise was saying before, I sign up somebody and they're like, oh, my coworker or my friend that I went down with, he might have a condition, but I assume he knows about it. Don't assume everyone knows about these programs, because it's always aha moment when people actually make the connection. Even if your brother had prostate cancer, even if your private doctor doesn't know about it. These are misconceptions that we're trying to get over.
Thank you. And, again, skin cancer, the most common cancer, perhaps because the pH level of the toxins was the same as Drano. Now, if you're home and your kitchen sink is clogged and you pour some Drano and it gets on your hands, you just wash it off. But it was, as those of you who know, the buildings were on fire for 99 days. That dust was just floating in the air for months afterwards. And it was going down people's shirts, down their neck, their ears, their faces. That's why we are seeing so much skin cancer. I was giving a speech to some retired firefighters, and I told them what I just told you. And I urged everybody, please go for an annual full body skin exam, which many people have missed since COVID. So if you haven't been for your annual exam, please do so. This guy, he was a dark-skinned guy, and he called me up about a month later, and he says, Michael, I just want to thank you. I went to my dermatologist, and I showed him this thing on my arm, and he said, that's nothing, but I don't like the color under your pinky nail. And he took a little biopsy, and sure enough, it turned out to be melanoma. And they removed half of his pinky, but it had already started to spread to his lungs. So he went under chemo, he had radiation, but you know what? He's alive today because of that exam. So I urge you, if you, we're just going to beat the dead horse here, but please go for an annual exam. For the women who haven't been for a mammogram because of COVID, go for your annual mammogram. And again, last thing, men, go for your annual prostate exam. Well, that's perfect segue to Liam Lynch of NYARNG. Hi, Liam. Liam, would you tell us a little bit of what is NYARNG and what do you do there?
Yeah, absolutely. It's well, hey everybody, it's such an honor to be on this panel and speaking with you all here. Really is. So I work for NYARNG. Along with Brian, we make up I'm New York City based, but we're part of the COSH network of Occupational Safety and Health, made up of worker advocates trying to create safer working environments. And we believe that, injuries and illnesses at work are preventable. NYCOSH was down there at the early days after the attacks, advocating for responders and survivors to receive the care that they deserve. And so now we have, these two programs that we're talking about today. We're talking about the World Trade Center Health Program, which provides, screening and treatment for your health conditions, including the 68 cancers that Lee was talking about. And then we're talking about the Victim Compensation Fund. So financial compensation, for the physical injuries that you may have sustained down there, including all of the cancers, and there's over 100 different certified illnesses that we're talking about, a lot of aerodigestive illnesses, GERD, sinus issues, right? A whole host of physical illnesses. And we're also talking about mental illnesses that the World Trade Center Health Program covers, PTSD, panic disorder, anxiety disorder. It's not just, when an incident happens, it affects us physically, of course, but mentally as well. So at NYCOSH, we are, helping people enroll in the World Trade Center Health Program. And, let me just reiterate and also add to what's been said. These doctors who are in the World Trade Center Health Program are specialized. The healthcare professionals in there are specialized in treating 9/11 responders and survivors who understand the unique circumstances of the conditions and have experiences in caring for this population. So you may love your primary care doctor, your specialist doctor, but like John was saying, it's important to see these doctors as well. It is absolutely worth the time. And, in the World Trade Center Health Program, treatment for your certified conditions, like medical visits, doctor visits, surgeries, prescription drugs, there's a pretty robust benefits counseling program. This is all at no cost, right? We're talking about a no cost program that is very specialized in treating this population. And also, this is not a static program. It is designed because of how it was lobbied for. It is designed to evolve with the changing needs of its patients. So the more people that are in the program, the more NIOSH has to study how these contaminants have affected these responders and survivors, and conditions can be added to the list of those that are already covered. So, data matters. And so if you are in the program, you can opt to have your data, be a part of this huge research effort so that we can, protect those or better serve those that are in the program now, but also possibly know how to respond and protect future responders and survivors of future disasters, God forbid. And, this early detection does save lives. And just to kind of hone in on that, there is a long latency period between the time of exposure to the development of conditions. So, yeah, we know that 9/11 was 20 years ago, and maybe you think, all right, I'm out of the woods, I'm healthy, I'm fine now. But unfortunately, some of the contaminants that were down there have what's called this long latency period, such as asbestos. So we know that we can be exposed to asbestos today, but not see symptoms or disease until 20, 30, 40 years later. And we're not out yet, 30, 40 years from 9/11. So there might be some conditions that are going to pop up in this population that we'll see as we get further away from it, which sometimes can be counterintuitive. And, let me just emphasize that this is a national program. Like John said, we had responders coming from all, across the country. And now, responders and survivors can receive care nationwide in all 50 states.
Right. So take advantage of that, even though you still may be going to the VA for other things. So Lee, let's talk a little bit about the Victim Compensation Fund Personal Injury Awards, because we've spent a lot of time so far this evening talking about the very important health program. But if you're certified by the health program with a 9/11 illness, well, then you're also entitled to a monetary award for your pain and suffering.
Exactly. So when the Zadroga Act was set up, it was split into two big entities. You have the World Trade Center Health Program on one side, which is free medical monitoring and treatment for the rest of your life. And then on the other side is the Victim Compensation Fund, which is a monetary award for pain and suffering while you're alive. And then, God forbid, you pass away from your 9/11 condition, your family will receive also a claim for a wrongful death aspect. So the Victim Compensation Fund covers for people that might have retired in 2009, got cancer, passed away, and now their family can make a claim as well. But the reason why the Victim Compensation Fund is so important is that in the end of 2019, John Feal, as I stated before, lobbied Congress with Michael and our whole firm to get this fund permanently funded and extended, because it's one thing to get your medical care costs covered, but it's another thing to be a 40-year-old that was a first responder, and then you get diagnosed with a horrible cancer and you can't earn money anymore for your family. The Victim Compensation Fund is making you whole again. So if, God forbid, you get diagnosed with a condition and you are in the health program, we urge you, don't assume you're part of the Victim Compensation Fund. They're two entirely different programs. They might work together, but they're completely different. That's why I speak to a lot of National Guard members and they're like, oh yeah, I'm in the program. I got certified. I'm like, did you make a claim to the Victim Compensation Fund? They go, no. And huge red flag, because we need everybody to be part of the Victim Compensation Fund. Now, if somebody gets let's say someone gets certified for asthma or respiratory condition, and they have their GERD and the acid builds up in the back of their throat, and they also have obstructive sleep apnea, you would make a claim for your pain and suffering of these conditions to the Victim Compensation Fund. And based on severity, these awards can range from 20 to 90,000. God forbid you get skin cancer, basal, squamous melanoma. Those awards can range from 90,000 to 250,000. Now, let's say in 2016, you got a $65,000 award for asthma, and then 5 years later, in 2021, 22, you get diagnosed with bladder cancer. We can amend your claim for an increased award based on change in circumstance, change in disability status. The VCF knows that the conditions will develop later in life. They also know you could have mild asthma, and in 1 year, it turned into a horrible, most severe asthma. So when the Victim Compensation Fund looks at you and looks at your claim, you can make a claim for pain and suffering, loss of earnings for economic loss, just like that firefighter or that responder that got disabled at 40. Who's going to take care of his family and his kids when he can't earn an income and he's just receiving small disability payments? But he's disabled because of the sacrifice he made on 9/11, because of his exposure, and you have to connect the dots.
Lee, what happens if someone is found terminal?
If somebody's found terminal, the Victim Compensation Fund has an amazing process to expedite a claim. And when I say expedite, let's say the typical claim takes a year, we can get an award turned around for the family in 2 weeks, sometimes even less, because if you have a stage 4 cancer and a shortened life expectancy, you're terminal. We're not going to have you wait a year and, God forbid, your family have to pick up the pieces for this. We want to make sure. And when I speak to my terminal clients, they don't care about the money. They care about their family. They care about making sure their family is taken care of. God forbid they succumb to their 9/11 condition. We would file a claim for your estate as well. And these
okay, so Lee, that's a perfect segue into our next slide, which are the Victim Compensation Fund death benefits. So again, I'm sorry to be just, showing you dollar figures, but sometimes, it helps people realize, wait, I'm entitled to real money that could make a difference, that could take care of my family, that can give me, and I can tell you this, it's a great feeling as an attorney. We lose a client every single day in this office. But to be able to tell someone the Victim Fund heard you, it's a non-adversarial process. It's not like you're going to be cross-examined. They want to help you. It's really terrific. but they'll do what they can. They're so compassionate, and they want you to know before you pass that your family is going to be okay. So Lee, would you just take us through some of the awards?
We could make a wrongful death claim for anybody who passed away from a 9/11 physical condition. So many times people didn't even know about these programs. Many times people passed away before these programs were even set up. So we make claims all the time, depending on types of conditions and so forth. But for wrongful death claims and awards, you will get $250,000 for the pain and suffering. Also, there's $100,000 for the spouse for the pain and suffering, and for any dependent. And when I say dependent, that is somebody that you were either living in your home, you were financially supporting. There are many different types of claims that can happen during a wrongful death submission. And that's why speaking to an attorney is so important, to make sure that you cover everything. There's something called replacement services, household services. You know, my husband, my wife, they used to clean the gutters, they would mow the lawn, they would do many services around the house that the Victim Compensation Fund covers for. Also, funeral expenses, out-of-pocket medical expenses. And the biggest one is loss of earnings, because just like I said before, you can have that 40-year-old first responder pass away at the age of 40, and you make an economic loss claim after that, and that's roped into the wrongful death award as well. So you can do an award while you're alive, and then we can have an award for you, God forbid you pass away. But you want to make sure that you're covering all types of claims that you can make.
Thank you. And I also would be remiss if I didn't say this. You don't need a lawyer to apply to the Victim Compensation Fund. You can do it yourself, but many people that we speak to, that we represent, feel it's well worth the 10% fee that Congress has limited lawyers to charge. But I just wanted to assure people, if you have any questions, go to vcf.gov. There's a lot of information there, or go to my firm's website, which is 911victims.com.
Let me just say something really quick. Michael, I know this bill better than anybody. This has been my life for the last 20 years. I used a lawyer on my VCF claim. It's 10% that I never saw. It's 10% that I didn't care about. Because when you're dealing with injuries and illnesses that affect the rest of your life, that are debilitating or life altering, you want somebody there that has your best interest. And you've heard me say it on national TV and anywhere. I'm not a fan of lawyers, but I'm a fan of good people who are lawyers who have your best interest. And I implore you all to get a good attorney to make sure that you're satisfied with your award, because this is the rest of your life, no matter how long it is.
I also feel like it's crucial to have a lawyer, and in particular, Barasch McGarry. And the reason why is, like, I've been working very hard on this for the past several years, and it is too hard to do alone.
What I want to close with is what you should do now. And the basic theme tonight is spread the word. Please tell your friends, your family, your former volunteers, your former Army National Reserve guys, hey, these programs are available to you. I'm happy to sign an affidavit for you. Would you sign one for me so we can both get into the health program? And if, God forbid, we're ever certified with an illness, then we're entitled to compensation as well. Register with the health program. There's the URL right there. But secure your evidence, even if you're healthy now. See a dermatologist at least once a year for a full body skin exam. Go for a mammogram, a colonoscopy, and prostate exam when it's time. Do a will and healthcare proxy. I can't tell you how many fights we as attorneys find ourselves in with many well-meaning family members whose the deceased individual passes, and there's a fight over who should be the executor. With name calling, it's just so unnecessary. If you do a will, you'll be doing your family such a favor, and also do a healthcare proxy so everybody knows what you want. You're always welcome to call us. All of our consultations are free. But we feel so passionate about you enrolling in these programs. Again, we say, just do it, even if you don't call us. I want to thank John Feal, Liam Lynch, Brian Brown-Cashdollar, Louise Schoene, and Lee. We are so proud to represent the 9/11 community in general, the Army National Guard in particular, all volunteers. And we say, be safe, be healthy, and protect yourselves. Good night, everybody.
Thank you.